So thank you very much for the question and time. Next, it's my pleasure to present to you Design for Health area. In our area of Design for Health, we focus on person-centered care, on the technology for health, on mental health and wellness, on policy and service design, supporting vulnerable groups, on the well-being of the young and the older adult, and as well of the carers. With this approach, our projects are about the design for health technologies, supporting healthcare innovation at point of care. It's also about the design of healthcare workflows, processes, and quality improvement solutions. It is about designing to support the experience of care and of receiving care, and it's also about the design of spaces for mental and physical well-being. So we are about 15 design research. This is just a glimpse of our Design for Health webpage in the TextileR website. We have more than 15 design research and working with a lot more of our colleagues across the university and across different universities. Working with twice as many HDR students and collaborating with colleagues and partners in key organizations such as Queensland Health, Clinical Excellence Queensland, Metro North Hospital Health Services, Northwest Hospital Health Services, Health Fabrication Institute, Aged Care and Community Organizations, and many more. Within the work that we do, we have, I'd like to show you part of the projects, but they are not the only ones that we have. They just show different areas of focus that we carry out in this area. So, for example, research in aged care, and you can see the one that is led by the there, the RC discovery amplifying voices from the Royal Commission into aged care and quality and safety. And this project aims to provide visibility to the aged care policy debates, reform Australian aged care, and redress the marginalization of aged care residents. It utilizes non-traditional approaches that combine art-based strategies and media analysis, poetry inquiry, citizen storytelling, interactive art, and participatory photography. And you're very lucky because we have this project exhibition on the screen, next door, and you can actually interact with it and see, what the experiences of carers are. Another project we have is on quality improvement in healthcare. And maybe some of you have heard about HEAL, the Healthcare Accelerator Lab, which was a collaboration hub co-led by QT Design Lab and Clinical Excellence Queensland. And it was designed to connect healthcare professionals across Queensland with designers in situ, in hospital, to explore and develop quality improvement solutions to issues identified by the clinicians' teams. In this program, we apply experience-based co-design approach, co-discovery, visualization and interaction technologies, photography for remote observation during COVID, and interactive prototype methods. Then we have another type of area, which is research about children's active play. And an example of this is the ARC discovery, I Want to Move It. It's led by Professor Tia Blacker, our assistant in research, and the aim of this project is to understand and develop a framework for designing technology augmented ways to increase preschoolers' engagement with active play. It explores how existing technologies are used to provide children with opportunities for active play. It investigates tangible interactions that might facilitate motor competence through manipulation, gesture, and whole body action. The next project is research with VR in aged care. And it's funded by Facebook. And you may have heard about that. It's been in the news, and actually our director, Professor Yvonne Miller, is at this moment shooting a story with Channel 9. It's funded by Facebook. This study utilizes VR technology in aged care settings to explore the experience of older adults, giving them the chance to revisit their past and explore new worlds or activities using this technology. The project has developed practical guidelines for implementation in aged care, a toolkit to help aged care facilities integrate virtual reality into the life of the residents. Another focus area that we have in Design for Health is research to enhance orthotic supply chain to remote Australia. And in this area, in this case, this is a CICT or a Cooperative Research Center project that utilizes advanced manufacturing and serving design strategies and biomedical technologies to deliver customized and culturally responsive smart societies for diabetic food patients in remote Australian hospitals. And finally, research with wearable technologies. This study explored the use of smart sensors to motivate people to correctly apply sunscreen and to make visible sun protection. It aims to understand how young adults use and interact with wearable UV sensors and what elements are critical to their design so that they will be practical for people to wear effectively. This research is about building knowledge about how to design fashionable, smart, wearable UV sensors for the young Australians who face risk of UV exposure during day-to-day and recreational activities. So these were just a handful of the many projects we carry out under Design for Health, and you can see that the focus is really diverse, from the young people to the older people, from manufacturing to quality improvement to workflows. There are 4 ways in which you can engage with us. You can work with us in our design unit, exploring it, using the design unit as a sandpit to explore new concepts. We can work in the School of Design Impact Lab, and at the end of the presentation, our engagement lead academic person, Mel Finger, will talk a little bit more about that. You can engage with us with the HDR industry internships, and of course, partnering with us in a project that you may be interested in. Welcome, of course.